I spend the most time, there's two pieces in this first level of workshop. This is the piece that I spend the longest time with. Because then you get it, you feel releases, we can do paired things. We can do motion with paired things. This is the cool part. You pick it up. It stops there, it stops there. There's the sweet point on abduction. You can start with the abduction plane if you need to instead of the flexion. Up and down, up, that's the sweet spot. Now, let's check the barrier. That's where it stops me. But you don't know how deep that barrier is, and you don't know how long to hang, and you've got to figure out why the softening's occurring, and I'm going to explain that. So here's what it's going to feel like. Now, fortunately, no, it's not, but I'm still going to use compression. Tension feels a bit easier, maybe not. When in doubt, take the passive. Compression is always passive, tension is always active. So now I've got him, I'm talking too much, he's tracking me, I got to shake him up a bit. Now I'm going to put a firm compression because he's a big guy. There comes the release. It's going to usually drop into an external. And this is why you're going to have me do it on you. So you can give the feedback how I've done it, so that when you do it, they can give you that feedback and you'll pick up, there it is. Now, what are you feeling?
A bit relaxed, and this portion is feeling a bit warm.
Okay. Now when I check it, the assessment on width will change, the assessment on height will change, and the barrier will change. So you could do 2 or 3 Fs. Now normally then you pick up, let it go, you pick up the bind barrier. Now, I must have spent 10 years only teaching compression without the tension. And then finally, of course, I'm slow with some things. Okay, this was one of them. Light bulb comes on, and I go, shit, I'm not teaching this enough and thorough. No wonder people aren't getting results. And I discovered, okay, the old school of MFR that went into stretches, cross hands, and elongations, John Barnes, Carol Mannheim, they said you would have to hold those positions for 7 to 10 minutes. Who wants to hold a lengthening for 7? You guys use belts, don't you?
Yeah.
That's why you're using a belt. You're trying to circumvent the time duration it takes for this tissue in elongation. Then I realized sensory receptors. So what I'm dealing is joint kinesthetic mechanical sensory receptors that monitor length, tension, position, and force. So I said, great, contract relax is my friend. If I have them pull back actively, perfect. On release, I do a tug. Passively, I also do what? Create what we were talking about, the joint, where are you? The joint space. Right? Putting it back into an open pack position. There, you can feel it start to kick. So, if its tension is ease, you must do a counter pull, and then on release, there's the active passive again. I'll gap the joint. Now, it's not yank their leg out of the socket. It's and you guys know better than anybody else, when I use the term stretch versus distraction, there is a force differential. I'm after distraction. And the beauty is a little tug, that's a low force, low velocity thruster. But there's no pain. It's all natural because it's letting go anyways. Now we've got the movement, we've got that. That's where he's stuck next. We've got to do another set of techniques. But now, here's the difference in the barrier. So that if you like to use oscillation, and motion is lotion, you got it. Does that make sense?
Yeah.
So let's go to the tables and do it.